policies and occupational health and safety issues, health promotion, the 5 tenets. 1. Public administration must be administered and operated on a nonprofit basis by a public authority responsible to the provincial or territorial government. 2. Comprehensiveness must provide coverage for all medically necessary services provided by hospitals, medical practitioners, and dentists working in a hospital setting. 3. Universality. 100% of the insured persons of a province must be entitled to the insured health services on uniform terms and conditions. 4. Portability. Residents moving to another province must continue to be covered by health services by the home province during any minimum waiting period imposed by the new province or residents not to exceed 3 months. 5. Accessibility. The health care plan of the province must provide a. Insured health services on uniform terms and conditions and reasonable access by insured persons. b. Reasonable compensation to physicians and dentists for all insured services rendered. c. Payments to hospitals in respect to the costs of insured health services. The role of the federal government responsible for setting and administrating national principles for the healthcare system through the Canada Health Act, assisting in the financing of the provincial/territorial healthcare services through fiscal financial transfers, delivering healthcare for specific groups, e.g. First Nations and Inuit, Canadian Forces and veterans, refugee claimants and penitentiary inmates, providing other health-related functions such as public health/health promotion programs, and health research. Cash and tax transfer payments are made to the provinces and territories in order for them to deliver healthcare services. Equalization payments are money the federal government gives to poorer provinces to help narrow the gap between have and have not regions. There is a formula used to calculate how much money goes to the various provinces. The role of the provinces and the territories in healthcare. The administration and delivery of healthcare is the responsibility of each province or territory. Provinces and territories fund these services through provincial taxes, with the assistance of the federal government in the form of transfer payments, and in some cases equalization payment. Health services include services of physicians and other healthcare care professionals, care in hospitals. Some provinces fund prescription drug coverage, some provinces have supplementary health benefits. So how do we deliver healthcare services? There are basically 2 different sectors that overlap to deliver healthcare to Canadians. Institutional sector includes hospitals, community and regional, mental health centers, rehab centers, extended care/long-term care/continuing care, veterans hospitals, federally funded but delivered provincially. Community sector includes family practice offices, walk-in clinics, ambulatory centers, community health centers, home health agencies, adult day care centers, school health services, support groups, community and volunteer agencies, palliative care/hospices. How the healthcare system works. Canada has a universal healthcare system funded through taxes. This means that eligible residents of a province or territory can apply for public health insurance to access publicly funded healthcare services. If you're an eligible resident, you may access these services through your provincial or territorial government's health insurance plan. Each province and territory decides who qualifies as a resident to receive coverage under their health insurance plan. While each province and territory has its own health insurance plan, they all provide basic standards of coverage for insured health services. These include medically necessary hospital, physician, and some surgical dental services. It's up to the provinces and territories to determine which services they consider are medically necessary and will cover. The roles and responsibilities for healthcare services are shared between the federal government and the provincial and territorial governments. The provinces and territories are responsible for delivering healthcare services, which includes regulating healthcare providers such as doctors and nurses. If you have a complaint about a doctor, you should contact your province or territories Ministry of Health, or visit about health insurance cards. College of Physicians and Surgeons. Visit College of Physicians and Surgeons of Canada about the services that are provided. The publicly funded healthcare system provides coverage for primary healthcare services, from diagnosis to recovery. These services include first contact services provided by a physician or other health providers, such as a nurse practitioner. The healthcare system also covers medically necessary services provided in hospitals. Learn more about healthcare services provided in hospitals. The provinces and territories also provide additional coverage to certain population groups such as seniors, children, people who receive social assistance. This additional coverage helps pay for healthcare services that are not fully covered by the publicly funded healthcare system. Services include home care, vision care, dental care, prescription drugs, ambulance services. People who don't qualify for additional benefits under government plans pay for these services on their own or through their own private health insurance plans. Healthcare services that are not insured under a provincial or territorial plan include cosmetic services, private duty nursing services, testimony by a physician in court, medical certificates for work, school, or insurance purposes, preferred hospital accommodation unless prescribed by a physician. Canada's role in the healthcare system at the federal level. The Government of Canada sets and administers national standards for healthcare, helps fund healthcare, delivers healthcare services to specific groups, provides other health-related supports. 1. National standards. We set national standards described in the Canada Health Act. 4. Provincial and territorial health insurance plans. The provinces and territories must meet these standards to receive their full payment under the Canada Health Transfer. The standards are: public administration assign a public authority to administer and operate the services on a non-profit basis. Universality provide coverage for all residents. Portability provide coverage for residents when they travel within Canada. Provide limited coverage for travel outside Canada. Provide coverage for residents who move to another province or territory for up to 3 months until they can register for coverage under the new plan. Accessibility give all residents reasonable access to medically necessary services. Give access based on medical need and not on the ability to pay. Comprehensiveness ensure medically necessary services provided by hospitals, doctors, and dentists. When dental service must be performed in a hospital, cover the full cost of medically necessary services. 2. Healthcare funding. We give funds to the provinces and territories in 2 ways. Direct healthcare funding through the Canada Health Transfer, additional funding through other fiscal transfers. Learn more. Canada Health Transfer, federal transfers to provinces and territories. 3. Healthcare services to specific groups. We provide certain healthcare services to eligible veterans, refugee claimants, inmates in federal penitentiaries, active members of the Canadian Forces, Inuit and First Nations people living on reserves. Learn more about healthcare services for these groups. Health services for eligible veterans, health services in federal penitentiaries, interim health care coverage for refugees, health care for Canadian Armed Forces members, non-insured health benefits for First Nations and Inuit. 4. Other health-related supports. We support health research, health promotion and protection, disease monitoring and prevention. We give tax support for health-related costs, such as tax credits for disability medical expenses, caregivers and disabled dependents, tax rebates to public institutions for health services, deductions for private health insurance premiums for people who are self-employed. We also regulate a wide range of products, such as food, cosmetics, chemicals, pesticides, medical devices, pharmaceuticals, consumer products, devices that emit radiation, for example, cell phones. Healthcare delivery. Levels of care within the Canadian healthcare system. Primary care is the first contact a person makes with the system during a given episode of illness. This is typically through the physician, medical clinic, or nurse practitioner. Secondary care provides for a more specialized service from a specialist. This is another level of care, requires referral, and is costlier. The public cannot access a specialist without a referral from their physician. Tertiary care is specialized in highly technical care in diagnosing and treating complicated or unusual health problems. This generally takes place in a hospital setting where diagnostic and complicated therapies can take place. Not all hospitals are tertiary care centers. These hospitals are usually located in the population-dense areas of the province or territories. Healthcare delivery. Consider some of the following healthcare delivery models and what this means to patients/clients and you as a health professional. What do you think about acute care? Individuals in a state of illness requiring hospitalization and the expertise and the equipment there. We hear a lot about hospital beds. How much is enough? Can there be too many? How does one plan based on the needs and resources? Continuing care, long-term care, residential care, home care. These services provide care for people needing ongoing care outside the hospital, either on a long-term or short-term basis. Think about the person discharged from the hospital who requires some care at home, or an individual with long-term needs. Emergency health care. Emergency services involve paramedic/ambulance staff and the emergency response team that is organized around each province. Public health, health promotion. This involves many ways to improve and enhance citizens' health. Program development and publications inform the public. Think of programs that promote the use of condoms, drug abuse strategies, and immunization clinics. Mental health services. People of all ages may need mental health services. These can be distributed across the community with priorities established within the system. Pharmacies. The drug distribution system relies on pharmacies, where pharmacists provide public education and individualized information to patients about appropriate medication. Addictions such as gambling, alcohol, and so on. Resources are available to assist those with addictions. Cancer care. Provinces/territories had multifaceted programs that coordinate distributed services. Dental care. Research your province to see if this is privately or publicly funded. Recent changes have made this more accessible to low-income people. Private or public health care. Hospitals account for the largest share of health expenditures, with physician services and drugs being the other costly items. The challenge for the system is how to sustain such expenditures while providing quality care and not cause deterioration to the system. There are challenges such as long waiting lists for diagnostic tests and surgeries, and long travel distances for services with some of the smaller communities. Medicare public does not cover all health services. Supplementary services are largely privately financed through employment-based group insurance plans, or an individual may buy private insurance. An example of this may be cosmetic surgery. The issue of privatization or private care for profit has long been a topic of debate in Canada. Some provinces/territories allow clinics and testing facilities to take patients who are willing to pay rather than wait to access the publicly funded health care system. Canadians have always been able to access private health care globally. Healthcare planners and politicians are discussing the benefits and threats of private funding. Primary health care. This is a concept that has been around for the last 50 years or so and represents a shift in philosophy, away from illness treatment and toward disease prevention and health promotion. It is based on the principles of equity, accessibility, social justice, community participation, socially acceptable technology, affordability, and collaboration within the health community. This relates to the key determinants of health. Key determinants of health. The health of a population is a process of looking at all the factors about populations and see how they interact. The process uses various data sources such as epidemiology, disease patterns, and social factors. In 1994, Canadian health experts researched why are some people healthy and others not. Key health determinants were identified: income and social status, social support networks, education, employment, and working conditions, physical environment, biology and genetic endowment, personal health practices, and coping skills, healthy child development, gender, culture, social environment. Compare these key determinants with the social determinants below. Are they similar? There has been a slow shift in Canada away from treatment of disease to more disease prevention and health promotion. There is hope that along with healthier populations, Canada's health care will eventually become more sustainable. Health promotion and disease prevention. Health promotion. Over the past decades, the field of health promotion has emerged as a way of thinking about the root causes of health and wellness. This thinking has sparked the development of new approaches to improving the health of individuals and communities. What is health promotion? Health promotion, as defined by the World Health Organization, 2024, is the process of enabling people to increase control over and to improve their health. Look up the Ottawa Charter for Health Promotion. What are the components and prerequisites for health? Health promotion has a number of unique features ensuring the health and well-being of individuals and communities that distinguish it from other approaches such as population health and disease prevention. These include holistic view of health, focus on participatory approaches, focus on the determinants of health, the social, behavioral, economic, environmental conditions that are the root causes of health and illness. Building on existing strengths and assets, not just addressing health problems and deficits. Using multiple complementary strategies to promote health at the individual and community level. Health promotion strategies. The following strategies are used to promote the health of individuals and communities. Health communication, the use of communication techniques to positively influence individuals, populations, and organizations for the purposes of promoting conditions conducive to human and environmental health, Nutbeam 1998. Health education refers to opportunities for learning that involve some form of communication designed to improve health literacy, including improving knowledge or developing life skills conducive to individual and community health. Self-help/mutual aid, a process by which people who share common experiences, situations, or problems can offer each other a unique perspective that is not available to those who have not shared these experiences. Self-Help Resource Center of Greater Toronto. Organizational change is the process of working within these settings in order to create supportive environments that better enable people to make healthy choices. Nutbeam 1998. Community development and mobilization, working with community members to assist them in the process of identifying and addressing their shared health concerns, is an important health promotion strategy. Policy development, healthy public policy encompasses legislation, taxation, fiscal measures, and organizational change initiatives. Advocacy, the process of gaining political commitment for a particular health goal or program, is a critical health promotion strategy. Disease prevention is the branch of public health practice concerned with the prevention of chronic diseases contributing to premature mortality, e.g., heart disease, cancer, stroke, diabetes. The three levels of prevention: primary prevention, engaging in actions preventing the initial occurrence of disorders or diseases by focusing on the risk factors or risk conditions which are associated with or cause increased susceptibility to specific diseases. Secondary prevention, stopping or slowing down the progress of a disease or disorder as soon as possible, before medical treatment is required. Tertiary prevention, reducing the occurrence of relapses of a chronic disease or disorder. Comparison of disease prevention with health promotion. Health promotion also focuses on the prevention disease and shares many of the same strategies as disease prevention. However, health promotion has a number of features and values that distinguish it from traditional disease prevention efforts. Health promotion includes 1. Focus on assets and strengths as well as risk factors and conditions. 2. Commitment to participatory approaches that builds the capacity of individual and communities to address their health concerns. 2. Greater focus on the social, economic, and environmental causes of health and illness. Disease prevention initiatives, by contrast, focus mainly on modifying the health behaviors of individuals. Social determinants of health. File. Primary health care, Nursing Now. File. This article is over 20 years old, a very arresting title. The time is now. How far have we come in Canada? How does Canada compare to where you grew up and perhaps practiced? Social determinants of health. CNA position. The social determinants of health are the conditions in which people are born, grow, live, work, and age. They are mostly responsible for health inequities. CNA recognizes the important but limited influence the health system has on health outcomes and acknowledges that addressing the social determinants of health needs to be a priority. CNA believes in a health-in-all policies approach to promote health equity. Policies addressing income, employment, education, housing, transportation, and other areas should be evaluated in their planning stages for their impact on health. CNA believes registered nurses, RNs, have both a professional and ethical responsibility to promote health equity through action on the social determinants of health. CNA believes that reducing health inequities, with a goal of eliminating them, must be a priority in all domains of nursing practice, in collaboration with others in and outside of the health sector. CNA believes RNs must include the social determinants of health in their assessments and interventions with individuals, families, and communities. CNA believes that nursing education must include the analysis of the social determinants of health, starting with a critical understanding of the political, economic, and social factors that are the root causes of health inequities. Background. The social determinants of health are understood as the conditions in which people are born, grow, live, work, and age, including the health system. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels, which are themselves influenced by policy choices. 1. These social determinants include the conditions of early childhood and access to education, the nature of employment and working conditions, access to healthy food and adequate income, social inclusion, access to housing, and the quality of both the built and natural environment in which people reside. Social determinants also affect the ability to access and use health care, which have consequences for the inequitable promotion of health and well-being, disease prevention, and illness recovery and survival. 2. Different groups will have different experiences of material conditions, psychosocial support, and behavioral options. 1. World Health Organization WHO, 2013, para. 1-2 Muntaner, Ng, and Chung, 2012, WHO, 2008, page 3. Page 2 of 5. Which make them more or less vulnerable to poor health. 3 individual choices are constrained or promoted by these conditions. Hence, WHO refers to the social determinants of health as the causes of the causes. The social determinants of health are mostly responsible for health inequities, for which are those inequalities in health that are deemed to be unfair or stemming from some form of injustice. 5 inequities are both avoidable and unnecessary, and they systematically burden populations rendered vulnerable by underlying social, economic, and political structures. 6. Health equity occurs when everyone has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of their social position or other socially determined circumstance. 7. A large and growing body of evidence reveals the links between health outcomes and the way economies create and distribute wealth and power. And since poor people live shorter lives and are more often ill than the rich, attention has been drawn to the remarkable sensitivity of health to the social environment. 8. These economic links are evident even in a developed country like Canada, where statistics show approximately 1 in 10 Canadians living in poverty, including 1 in 4 First Nations children. 9 Populations often overrepresented among those with worse health outcomes include persons living with disabilities, ethnocultural minorities, persons living in rural and northern areas, lone parents, immigrants and refugees, and persons with limited literacy skills. 10 First Nations, Inuit and Métis. People experience barriers to health due to a history of colonization, racism, and social exclusion, as well as the repression of self-determination, both in general society and within healthcare. 11. In fact, the link between health and social environments runs so deep as to include every level of society, not only the most vulnerable. The effect follows a social gradient, where even those in the middle classes will generally have worse health outcomes than those in upper classes. Moreover, the health of communities in their entirety is affected by reduced productivity, increased social unrest, and higher crime related to decreased community cohesion, and families' daily struggle to meet basic needs. Point 12. 3. WHO, 2008, page 3. 4. Canadian Nurses Association, CNA, 2010. 5. Kawachi, Subramanian, and Almeida Filio, 2002, page 647. 6. Krieger, 2001, page 698. 7. Whitehead and Dahlgren, 2006, page 5. 8. Wilkinson and Marmot, 2003, back cover para. 1. 9. Human Resources and Skills Development Canada, 2013. Raphael, 2011. 10. Human Resources and Skills Development Canada, 2013. Public Health Agency of Canada, 2008. Standing Senate Committee on Social Affairs, Science and Technology, 2009. 11. Canadian Association of Nurses in AIDS Care, ND, page 2. Reading and Veen, 2009. 12. Wilkinson and Marmot, 2003. Page 3 of 5. Action on the social determinants of health. Providing health care is not the highest priority in addressing the huge global burden of illness. The main action on social determinants of health must come from outside the health sector, by addressing adequate income and housing, food security, social inclusion, and early childhood development, among other causes. Point 13. WHO's Commission on the Social Determinants of Health uses the following 3 principles to guide the work of eliminating health inequities. 1. Improve the conditions of daily life, the circumstances in which people are born, grow, live, work, and age. 2. Tackle the inequitable distribution of power, money, and resources, the structural drivers of those conditions of daily life, globally, nationally, and locally. 3. Measure the problem, evaluate action, expand the knowledge base, develop a workforce that is trained in the social determinants of health, and raise public awareness of the social determinants of health. 14. Health in all policies is an approach that considers the health impacts of policies in areas such as finance, education, housing, employment, and transport. It assists leaders and policymakers to integrate considerations of health, well-being, and equity during the development, implementation, and evaluation of such policies and services. 15. For the most part, health professionals, including nurses, have focused their interventions on changing health behavior. 16. And improving healthcare accessibility. Although these may indeed be proximal or intermediate causes of poor health, 17. The social determinants of health at a structural level are the most significant, because they influence health both directly and indirectly. 18. Rather than focusing on the individual, then, attention must be paid to the structures and processes that maintain power and privilege for some and marginalization for others. 19. The CNA Code of Ethics for Registered Nurses states that nurses should endeavor as much as possible, individually and collectively, to advocate for and work toward eliminating social inequities. 20. Similarly, the ICN Code of Ethics for Nurses states that the nurse shares with society the responsibility for initiating and supporting action to meet the health and social needs of the public, in particular those of vulnerable populations. The nurse advocates for equity and social justice in resource allocation, access to health care, and other social and economic services. 21. 13. WHO, 2008, 14. Ibid, page 2. 15. WHO, 2010, page 2. 16. Schrecker and Thaler, 2013. 17. WHO, 2010, 8. Page 4 of 5. Page 3 of 5. Action on the social determinants of health. Providing health care is not the highest priority in addressing the huge global burden of illness. The main action on social determinants of health must come from outside the health sector, by addressing adequate income and housing, food security, social inclusion, and early childhood development. Page 4 of 5. Page 4 of 5. 5. Nurses in all domains of practice can address social inequities by recognizing the significance of the social determinants of health at an individual and collective level and including them in assessments, diagnoses, outcomes planning, implementation and evaluations. Providing sensitive, empowering care at the individual, family and community level to those experiencing inequities. Engaging with health and social organizations in policy analysis and advocacy to promote health equity and for change in inequitable health and social policies, legislation and regulations. Advocating for publicly funded, not-for-profit healthcare services that are available to all and supporting environmental preservation and restoration. Point 22. Approved by the CNA Board of Directors November 2013. References: Canadian Association of Nurses in AIDS Care, ND. Cultural Safety for First Nations, Inuit and Métis People Position Statement. Retrieved from http://www.conacy.org/positions/cultural%20 safety%20 ps.pdf. H